Welcome back to Better Pet Parents, everybody. Thank you so much for being with us again. So, today we're going to be talking about veterinary specialists. This is a topic that I feel very passionately about just because in my personal life I have had such good experiences dealing with veterinary specialists. And professionally, I've had so many of my clients have such good experiences dealing with veterinary specialists. So, if you're somebody who has never been to a veterinary specialist, hopefully it's because you haven't needed one. Most of the issues that we face with our pets' healthcare along the way can be handled by our primary veterinarians, but then when our animals develop certain diseases or conditions or problems in their senior years, sometimes we end up taking them to a veterinary specialist. Veterinary specialists are also there to deal with injuries that might happen at any age. Certain things like orthopedic surgery and things like that can be handled by specialists. So they're there to treat a wide array of issues. They're there to be able to provide maybe more in-depth testing than what your primary veterinarian has in terms of the medical equipment that they have at their primary clinic. So they're there for all kinds of reasons, but hopefully, if you've never been to one, it's because you haven't needed one. Just like when we go to our own primary care physician, and you say that you're dealing with, let's say that you're dealing with a heart issue. Well, your primary care physician might make certain recommendations, and then at a certain point, they say, "I want you to see a cardiologist." And the same thing happens with veterinarians. So, this is a conversation that we've had in previous videos about how, when it comes to veterinarians, this is different from human medicine in the sense that when we go to our primary veterinarian, that doctor is wearing so many hats, more than human doctors have to, because people expect for the veterinarian to be a one stop shop for anything that their animal needs. And we don't do that in human medicine. We expect for our teeth to be handled at the dentist. We expect for other, you get the picture. But when you go to the veterinarian, you expect for them to do everything. And that's one of the reasons that I always say here that none of us those of us who are not veterinarians cannot imagine how difficult that profession is because they're always having to wear so many hats. But sometimes when they get a client who, has a case that is beyond what they can test for at their clinic with the equipment needed to handle a certain case, or there's a specialty skill needed, they're going to refer that person to a veterinary specialist. And those people have gone through the correct training within medical school to be able to specialize, and they've done residencies and they've done board certifications and that kind of thing to be specialist. And like, so for example, with my own pet, my pet was diabetic, and I absolutely loved our primary care veterinarian. He was, I still consider him one of the most intelligent people that I have ever known and had the privilege of knowing. And when he was treating my dog's case, we would go all the time and discuss a wide array of things that were going on with my pet. And at one point, he just said to me, "I really would like for you to see an internist." And I said, "I don't want to see an internist. I don't want to deal with anybody except for you." And he was like, "I want you to see an internist." And he convinced me to go. And I had a wonderful experience with that internist, and had the privilege of working with her, who was also just one of the most intelligent people. And I was very, very fortunate to know her. And so sometimes when you're dealing with certain issues, a specialist can help you. And I want to advocate for this today because in my experience as a professional groomer dealing with my own clients who tell me all the things going on in their animals' lives, the one complaint I hear about specialists is people being afraid of the cost. And it's true. When you go to a specialist, you're going to pay more for that office visit than you would at the primary doctor. But the situation has more layers than that, because if you're somebody who's going to the primary veterinarian all the time and you're paying for, all the things you're trying at the primary veterinarian, all the office visits at the primary veterinarian, and your veterinarian might say, I really want you to see a specialist. It might be because you guys have exhausted all the options that your primary veterinarian knows to try. And in those cases, they want you to go on and see somebody that specializes because they're trying to help you. And sometimes when you do that and you go, well, if you see a specialist, let's say that you've been dealing with skin issues chronically with your primary veterinarian, but then your veterinarian sends you to a dermatologist. Well, your dermatologist might be able to look at that in the first visit and say, this is what I want to try, and maybe you get a different result. And so sometimes when my clients are telling me stories about not wanting to go to the specialist, first of all, I can relate because I was somebody who didn't want to go to a specialist. I didn't want to go to a specialist because I wanted my primary veterinarian to be the only person I dealt with. I trusted him and I didn't want to deal with anybody else. And I was wrong. And I had a wonderful experience. And they worked together to provide care as a team for my animals' needs. And I was able to broaden my perception of this. And but I understand sometimes too that a lot of my clients are saying they don't want to go because of cost, and I tell them when they talk to me about that, I say, well, if your veterinarian is recommending you go, you might want to give it a shot because you've been telling me for a year that you're going to the vet all the time and that you're still dealing with the same issue, and you never know if seeing a specialist might, what a fresh pair of eyes might be able to do for the case. And so, and a lot of times your veterinarian might be recommending that for that very reason. They might want a fresh set of eyes on the case. And sometimes that can help them collaboratively offer the right care to your pet. I also like to advocate for specialists for these people that don't have a regular veterinarian who they absolutely love and trust. I'll give an example. So I had a client few years back that had a senior animal who was having some kind of neurological episodes, it appeared to be. And so she was going to the most local clinic for her, the one that was closest to her. And she was taking this dog in, and she was saying that he was collapsing and having some kind of episode, and they assumed that it was seizures. And they were prescribing seizure medication and things, whatever they thought was right for that pet specific case. And it kept happening. And this client was talking to me when I was at her house grooming the dog, and she was saying, I don't really care for this clinic that I'm going to. They told me that my dog is just old and having seizures. And I said, well, maybe he is old and having seizures, but if you didn't care for the service you received, or you're not feeling right about it, if you don't feel like you're somewhere that has the right fit, I always tell people, if you didn't feel right about your own doctor, you'd probably go get a second opinion. And I said, I think you should go get another opinion. And so I told her about another clinic, and she went and really liked that clinic and felt like, she was listened to there and maybe had a better experience. You just have to find the one that's right for you. Everybody has different preferences about bedside manner and things. And so this client went to a different clinic, and they said, we want you to see a specialist. And so she went to a specialist. And this specialist figured out that this dog was essentially like coughing and choking and passing out. And it was not seizures at all. It was a coughing episode. And the specialist was able to prescribe a cough medicine, and the episode stopped. And so that is one of the most unusual stories that I've heard in my years working professionally with animals, because I was like, this is like the craziest story about going to see a specialist, and how sometimes a fresh pair of eyes can really offer a solution. So I do just want to advocate for this, that you do not always need to just assume that seeing a specialist is going to cost a fortune. Sometimes veterinary care can be outrageously expensive. I've lived it. I understand it. I I know that sometimes it can be, which is why we've had a lot of conversations here in the past about asking your veterinarian about pet insurance and being as proactive as possible, because when things happen, they can get expensive and they can add up. But for the sake of today's conversation, I just want to point out that if you were going to a doctor that you didn't feel like it was the best fit, always be willing to go get a second opinion. Or if you feel like you've exhausted your options with a primary care veterinarian, don't be afraid to just go get a fresh set of eyes on the case, at a specialist. It never hurts to just go once and see what somebody has to say. You never know if it might help if you're dealing with a complicated veterinary case. And by all means, if you have a veterinarian who you love and trust, like the one that I did, and they are telling you that they want you to go see a specialist, then absolutely trust their opinion. Because I argued with my veterinarian a little bit on this, but he knew what was best for my pet, and he knew what he wanted from my pet, and we were able to gain somebody of so much value to his case in our internist. I also took my an ophthalmologist, and the value that she brought to my pet's life was priceless too, because with my pet being diabetic, he developed diabetic cataracts, and I took him to an ophthalmologist, and she was just absolutely wonderful and helped us through that, and was able to surgically correct that and maintain the health of his eyes throughout the rest of his life. And so specialists are so amazing in the work that they do, and I don't want people to just assume all the time that they shouldn't go to one, or that they can't afford one, or that it's a waste of time, because those are misconceptions and they are not true. And I highly recommend that if you are somebody who could benefit from it, that you have a very detailed conversation with your vet about what's best. Always understand your options, and don't be afraid to see one if it could help your pet's case. So give this some thought. Let us know if you have any questions or comments, and we'll see you again next week for another discussion. I wish everybody the absolute best on your pet parenthood journeys. Thank you for being here.